I was asked today to address you, and the topic is a healthier community and how we can work together to make our county and our city safer. So in order to have that discussion, you really have to talk about crime, our crime problem, where we are, and what we are doing in the court system and on our end to make this place safer. So this is a slide that shows our case statistics. And our cases, if you look on the your far right, our cases have stayed pretty consistent. One of the things I wanted to point out here, these are our PFA contempt cases, and that would be when an individual gets a protection from abuse order. That's mostly of our domestic violence situations. But in 2016, we had 43. So that's raised from 13 in 2015 to 43. These would be people that we are prosecuting that are under a protection from abuse order and are violating it. And I'll talk more about domestic violence as we go. But our caseload has stayed pretty consistent. And this is the number of cases that come to the courthouse. There are much more that we're handling at the magisterial district level, the lower court level, that are not referenced on here. So in order to talk about crime, I just like to give some statistics on our murder rate since I've been DA. And the reason I do this is many are drug-related and many are domestic violence-related. And in order to understand crime, this is our worst crime that you can commit, and this is the number of lives that we're losing. So since I've been DA in 2010, we've had 52 individuals who have been murdered, have been victims of murder, and their lives have been taken. In those incidents as well, 3 have been shot but survived their injuries. So we've had 47 separate cases that we've investigated, and I have a tab under there. We have an increase in number of deaths per incident. So if you look down, we've charged 35 defendants. That seems like a discrepancy. But when we look at 47 separate cases, we count the number of deaths in total. What we've been finding is that we've had situations where there are multiple people dying in one incident. So to us, that would be one case. But we have had situations where we've had 3 and even 4 individuals being murdered as part of one incident. So that's been something new that has started here. Also, under the 35 charged defendants, we've seen an increase in the number of actors per incident. So we have 2 cases right now pending in the court system where 3 defendants are charged with the death of 1 person. So there, we have 2 of those. So basically you have 6 defendants charged with the murder of 2 separate individuals. So again, we count it as defendants in cases. That's why the numbers are a little bit skewed. 16 of our murders have been domestic violence, 8 in the city of Johnstown. And an alarming number here, there have been 6 domestic violence murder-suicides. And even though there's no one that we can prosecute as a result of those incidents, they're still investigated by police. They're reviewed in team settings with other agencies in the county so that we can look back and plan, did the system fail? What could have been done to better protect these victims? And many of them there, at least one in the city was a PFA violator who, had a PFA, had gotten out of jail and gone back and murdered his estranged wife and also a son. So two died in that. So that's an alarming statistic there. And we've had 4 child victims. By far, as prosecutors, the hardest cases we deal with are child abuse cases. For 10 years, when I was first in the office, I did all of our child abuse prosecutions, physical and sexual assaults. These children listed here died either in neglect situations, blunt force trauma, or shaken baby cases, very tough to deal with. The case we had in December, there was a couple that overdosed and then their child died of starvation. That was ruled a homicide under our criteria and under the coroner's because that child died due to criminal activity of her parents. We've also had 26 drug-related homicides that are related to drugs in some manner. You can see 23 of these occurred in the city of Johnstown. And then there are some that you just can't put into a category. We had a Murder-suicide that was not domestic violence related. It was a fight that broke out in like a man cave of a house that went too far and became a murder-suicide. We also had a murder in our prison. We had a nursing home murder. Believe it or not, it involved two patients with severe dementia and Alzheimer's. So we weren't able to prosecute in that situation because of the capacity of the actor. However, he passed away shortly after the murder occurred. And then there are some you just can't categorize into any category. They're just random acts of violence. But we are seeing now some remnants of gang activity starting around the area. The one that comes to mind, we had a situation which was a drive-by shooting over the course of about 2 blocks. There were numerous shell casings in the roadway, and we knew there were 2 groups working against each other in that drive-by shooting. So we have started to see gang-related activity here in the city. 13 remain under investigation. This is a really hard statistic for us in law enforcement to swallow. And I talk about it a little bit later, why this is and why we're having such difficulty finding evidence and getting enough to charge people. But you can see 10 are in the city, 2 are in West Hills, and 1 is in Richland. These are homicides where, for one reason or another, we just don't have the evidence to link who the actors are at this point, but we're trying, and that's something we never stop trying to do. And 31 of the 47 murder incidents occurred then in the city of Johnstown. So 66% of the murder rate is happening in the city. This is a breakdown of how you can see the escalation. We peaked in 2013. We had 10 homicides. And just to talk a little bit about the impact of these in the DA's office, we team prosecute these cases. So there are 2 assistant district attorneys assigned to every murder case. If I'm not one of the assigned assistants, I am supervising those who are doing the cases. I'm involved from beginning to end to all of these because they are so important. So our overall caseload has remained pretty steady. However, our violent crime has increased and our gun violence has increased. To that effect, they go hand in hand with our drug problem. As you get more dealers supplying drugs in our area, they bring with them violence. A lot of our drug dealers, I'd say most of them, are not drug users. They are business people. Most of them are men, although we're seeing many women getting involved in dealing drugs as well. They usually have a system of workers underneath them that they are controlling, that they are having going out and doing their business. But with the drug problem comes violent crime. On the flip side of that, we have people who are addicted who are going out and committing crimes. Some of the people who are addicted, you would never expect them to be people that would deal drugs, but they're switching into dealing drugs to support their own habit. So it used to be easy for us in the court system to say, hey, we want to put these dealers away. You know, they're infecting our communities, they're bringing in this poison, you know, put them in jail. But now we have these addicts that, you know, switch over and might sell drugs that one time because they need the extra money. So it's become more of a gray area for us to identify who's a hardcore addict who's, you know, running a business for profit versus, you know, who is someone that's addicted and struggling to maintain their source of drugs. But either way, they're dealers, and we're going to take care of them in the court system and charge them when we can. The other thing that the addicts will do is they are going to resort to whatever means necessary to get their next fix, to get their drugs. This has been hard for the community. This is where you're seeing your armed robberies, break-ins at homes. And I've been, as DA, 3 of the categories of victims that I've always tried to service are children, women, and our seniors. And sometimes people don't think about it, but this drug problem is affecting all 3 of those groups. So our children are affected because many of the people who are caring for them are on drugs, their own parents. They don't know what to do. They don't know where to go. We had a situation in Johnstown where a little girl, police responded, a little 6-year-old girl said, oh, my mommy just took her medicine. Her mother had overdosed. And she described to a T how her mom went and got her rubber band and put it around her arm, and she got her spoon and she heated her medicine and she put it in her shot, and she gave herself a shot. And that, to this little 6-year-old girl, was mommy's medicine. So they're being raised in these homes that are dangerous. I've talked to many first responders, the police, and in my opinion, if you are using drugs and you are responsible for children and you overdose, that is child abuse. You have rendered yourself incapable to take care of your children, so we are making that a mandated report to Child Services. Also, when you look at our women are falling into being victims in this drug epidemic that we're having, and this is where our human trafficking comes in. So we have addicted, especially young females, but it's happening to males too, who are being manipulated because they are strung out on drugs to perform sex acts for profit for their pimps. So we have our drug dealers, and then we have our, sex dealers is what I would call them. So we are looking at that link. Our women population in the prison reached 90 women in prison not too long ago. That's unheard of for us. When I first started prosecuting, it was very rare we saw a woman charged and in court, and now I'd say it's 50%. So a lot of women are becoming addicted to drugs and getting into the system. And finally, our seniors, something you don't think about our seniors, they are vulnerable in this drug trade because of two things. One, they're called upon many times now to raise their grandchildren because their children are addicted. So we have a lot of grandparents who have to step up and become parents again. With that, they're dealing with all the issues of teenagers that they had to deal with years and years ago. So thank God they're willing to do it, but that poses a lot of problems for them. The second way that they're vulnerable is that a lot of times they are on medication. They might have an illness and they have prescription medication in their homes or in their medicine cabinets. That can make them vulnerable to theft by family members who are on drugs or anyone else who's coming and going out of their lives. And the third way they're vulnerable is their money. So we've had a lot of addicts plowing through the money of their grandparents to get money for their next fix. We actually had a situation where there was a woman who thought she was paying her grandson's tuition at IUP, and gave him a check for upwards of like thousands and thousands of dollars, and it never went to his tuition. So those kind of things. Our synthetic drugs have surfaced, and they present dangers as well to our first responders. We in the county, we've notified police departments and our task force not to field test in the field any drugs anymore because you don't know what the chemical makeup is, and you can get a touch, I don't know the right word for it, but you can become infected just by touching it. So, and heroin by far has surpassed every other drug for the last 3 to 5 years in our county. So how do we get here? I know you guys are all in the medical profession. I'm not going to spend much time on this. Heroin is linked directly to our prescription drug problem. People are going in for routine surgery, they're getting meds, and many are getting addicted. Our typical heroin user, you can't even define. The ages range. Our youngest overdose last year in the county, I believe, was 16-year-old. The oldest was 61 years old. It's both men and women, and it's happening all over the county. So I always like this slide, future heroin users. Sometimes I think back in the day when you thought of somebody on drugs or someone dealing drugs, you think of someone out on the street corner and downtrodden and maybe homeless and not looking like this. But the truth of the matter is anyone's subject to falling prey to this addiction, especially because of the pain meds. So here you have two business people that could be working and functioning with a severe addiction to either prescription meds or, once those meds are taken away from them, jump to heroin, and you might not even know it. They can keep it up for a while. So a lot of people ask me, why do people choose Johnstown? Why do they come here to deal their drugs? Because a lot of times when you look in the paper and you see the crime report, they're from Philadelphia, New York, Ohio. Like, what is the attraction here? So the biggest thing is the profit they make here. They make so much more money coming here than they'll make in a big city. We have the demand here. With some of the later slides, you'll see just about how bad our addiction rate is here in Cambria County. We're on track this year to lead the state and surpass Philadelphia. So when you think about that, Philadelphia per capita, is much larger compared to us, but we are suffering the same statistics. But clearly the biggest reason is they make more money here. They can sell their stamp bags for a higher rate. They also find it to be safer here. If you're in a big city and you deal on the wrong street corner, you're going to get shot. Gangs, you better know whose territory is what territory. So these dealers can come here. They have less competition because there's not as many of them here. They can build their empire up and they can become the big fish here in our small pond. And believe it or not, even though we open the paper and think, all this crime, there's a shooting last night, there was this, there was that, they feel it's less violent here than they face in the cities that they're coming from. So it's attractive to drug dealers. Some of the investigative challenges that we've had in prosecuting and charging people. Drug dealers go to great lengths to conceal their identity. You'll hear their nicknames. You'll never hear their real name. I'm sure in the hospital you get the same runaround here. But I remember I did a prosecution in a murder case, and a key witness for us was a woman who had been dating the shooter for 3 months. And when the police interviewed her, she didn't know this guy's real name, even though he'd been living with her. She knew him as B. So we get names like B and G and Taco, and they don't want anyone here to know who they are, where they came from, or what they're about, because they're trying to run their operations and avoid police detection. Others in the drug world are not cooperative. This is why many of our cases are going unsolved. You've probably seen it here in the hospital. We've had individuals who have been shot, transported here for treatment. They're up on the floor. The police go in to interview them, and guess what? They didn't see anything. They don't know. They will not cooperate. I think there's a couple reasons for that. One could be fear. They're afraid to tell the police what happened because, they're part of this culture. Number two, I think that there's just a general societal thing with this segment of society that it is not good to cooperate with police. You're labeled a snitch, and you just don't cooperate with the police. Back in the day when we had somebody who died as a result of crime, people were willing to come forward. That has totally changed. We have a complete disconnect with anyone really giving any good, credible information to the police. Also, good citizens are afraid to come forward. So, you might be out and about and you call in something you see. Well, guess what? Now you're a witness. Now you're coming to court. Now you have to face these people. So a lot of people just shy away from it. You're driving down the road and you see something and should I call it in? Well, maybe I won't. I don't want to be involved, or maybe I'm wrong. I don't know what's occurring. So one story I always tell here, I did a child abuse case, the worst child abuse case that I handled in my career. It was a guy who had been at a party, and to back up, the victim was a little 6-year-old girl, and her parents were on house arrest because the father had multiple DUIs. So they had bracelets on. The father had a bracelet on, not the mother. But since he couldn't go out to the bars, they decided to have a party at their house. So they invited people to come over. Well, unbeknownst to them, they claim, they invite over a person who was on Megan's Law, a sexual offender. They wake up in the morning after drinking heavy and being passed out, and their 6-year-old's missing from their house. They don't call the police. They go out and search for her themselves. and they find her with this gentleman who's kind of walking her back to the home. She runs up to them and immediately, starts crying, tells them what happened. What we found out was he took her to his apartment and he raped her at least 3 times in his apartment. We had a woman who lived in that apartment building. It was a 3-story building. The rape happened on the 3rd floor. This woman lived on the 2nd floor. It was a summer morning, and she had her windows up. She had just gotten off from a shift. She was a nurse, had just come home. She was trying to sleep, and she said she kept hearing like a child, but it wasn't a scream. It was kind of like a moan, but it wasn't a cry. She knew there were no children in the building, and so she didn't call it in. And believe me, this is not her fault at all. I'm not. The point of the story is, if you have this gut feeling, you should call it in. But what we found out, and when she found out what happened to this little girl, she was really upset at herself for not calling it in. When he raped her in the bedroom area, he had put a pillow over her head and muffled her scream. So what she was hearing was that muffled scream. So why I tell that story is, you don't have to solve the case. You don't have to really do anything but make the call. If it's nothing, that's what law enforcement is there for. We are there to respond and make sure everything's okay. If it's something, then it's on us. It's not always on you. So you can call 911 anonymously, but I call it the gut test. If your gut says something's in disarray, call it in because you can really help us and you can really stop bad things from happening. And we've seen a huge increase in felons with firearms. This, again, ties back in. What we're seeing is our young females in the area, for whatever reason, are falling into line with these drug dealers. They have felony records. They can't get weapons themselves. And a lot of the women are going up purchasing them for their boyfriends, which, again, with human trafficking, what these men do, they court these girls for about, 2 to 3 week period. They can meet them in the mall, wherever. They try to find the most vulnerable female that they can find, and they shower them with gifts and, you're my girl and we're in a relationship. And then they turn on them and say, now you love me so much, you're going to do this for me. The same with the guns. They're getting these young girls to do these stupid things like go up to and buy a gun and hand it over to them. And it's really hard to prove that without them telling us. So just another challenge. So we looked at what can we do. We know we have these problems. They all stem back to drugs, most everything in one way or another. So what we tried to do at the county level, and I spearheaded the effort with many other people, is we created the Cambria County Drug Coalition. Here's the website here. A lot of good information on there if anyone wants to access it. But what we had found, and this has been for 2 years, we've been studying, through the coalition how to attack our problems. And what we found is there are so many people doing such great things in all these areas. You have your health care, you're handling what's coming through the hospital, you're trying to get people to treatment, your mental health staff is doing wonderful, your social workers are trying to connect people to services. You have your prevention and education in the schools and at the universities that are doing great work. Treatment, there's so many treatment providers for drug and alcohol in the area and the surrounding counties. You try to get them there. Law enforcement, we're out there. We're trying to make arrests. We're trying to make a difference. We're doing what we can do in prevention to try to get kids to stay away from drugs. And then you have the criminal justice system who, we're trying to lock up the serious offenders, trying to find a way to work with the people who want help to get them back on track so they can be productive citizens, because I've said all along, the drug dealers are transient. They come here from out of the area and set up shop here. But the people who are addicted, they are ours. They're our citizens. They've been born and raised here. They live here. Their families are here. They're not going anywhere. So treating them should be a major, major priority to try to get them to be productive part of our communities, because they live here. They're not transient, and they're going to stay here and remain here. So we tried to build a collaborative group through the coalition to represent all of these areas: law enforcement, criminal justice, prevention, treatment, and healthcare, and to plan for how we're going to attack it. So this is just a timeline of kind of the process that we took to get where we are now, and it's been a work in progress. But we are right now in the subcommittee development process, so we are following the Drug-Free Communities model, which is a national model, which provides for 12 subcommittees that I think are on a later slide. So that's where we are now. We're also still trying to build our board and do a lot of the organizational structure of the coalition, and I chair the board. But so why we developed was to really, again, attack this on a community front. We needed to bring all the right people to the table because so many entities and agencies deal with our drug problem. So we really, our goal is to be like a united hub for information, for resources, and to provide help and assistance to everybody who's working in these areas of heroin and drug abuse. And one of the first things we did was our strategic planning process. We are also trying to model Operation Our Town from Blair County, if any of you are familiar with Operation Our Town. Here are the subcommittees that I talked about developing, and many of you would probably be great candidates to sit on some of these subcommittees. But it's the business community, civic leadership, drug treatment and recovery, faith-based, government and courts, healthcare, law enforcement, parents, guardians, and grandparents, youth, and youth-serving organizations. So the goal is those 12 subcommittees will form, they will have a chair, and then they will report to the board of directors. We also know that we need to track our progress and report out to the community. So that is happening as well. This is our board for those of you who know anyone on the board. I chair it. We have a commissioner, Tom Chernisky is the vice chair. Sue Mann from 1889 is the secretary. Bill McKinney, United Way, is the treasurer. Jeffrey Jansiga is from Johnstown Police Department. He's now the captain. John Morgan, a retired Conemaugh administrator, and Dr. Jeannie Spencer from your family medicine practice here at Conemaugh. That is our board of directors. So why do we need a coordinated effort? Some of these slides really depict our problems. So this is the slide from 1999. The areas of red show drug overdoses per 100,000. So the bright red areas are the plus 20. So this is 1999, and look how it shifts in 2014. So again, that graphic is really telling. You go from, you know, a country that has some here and there, some dark areas, to a country that's struggling in every state, in every area. And the blue arrow is our county there in Pennsylvania. This is the number of drug deaths reported by population in 2015. You can see Cambria was second. Again, I think this is per 100,000 population, and we were at 41.8. And Philadelphia, you can see, is the only one ahead of us, was at 44.8. When you switch to 2016, we are now, you can see it's over here, 65.4, and Philadelphia is 59.4. So we have surpassed Philadelphia, and we are leading the state in the number of per capita overdoses per population. So we got a real problem. A lot of people talk about, oh yeah, the heroin crisis, you know, and you talk at your dinner table, but when you look at the real statistics, do we really, really have a problem? Yes, we really, really do. This is the coroner's statistics and the increase in overdoses from 2010 to 2016. We had 94 overdose deaths. Through my office, we are also trying to track the overdose lives. The individuals who overdose and survive is a category of people that we believe we can help, and those are the target of our new warm handoff policy. But it's been difficult to track. So what, because there just are so many. You guys are seeing it here at your facility. But what we are trying to do, and I honestly believe this, back in the day, an overdose incident was not a police response. It was more of a healthcare response. I believe there's a lot of valuable information to be gained from an overdose where an individual survives. If nothing else, to have a police officer show up at their door and engage them in a conversation where you are asked, where did you get your drugs? You know, what lifestyle are you leading? Who are your connections? Rather than, you know, I hear here, they come in, they overdose, they're revived, they're treated, and they can't wait to get back out the door, and they're going to go use again, and they've had not one question asked of them by a police officer. What happened? Where'd you get it? What did you do? And a lot of people don't understand, we can't charge them with having drugs in their system. If you find something here in their pocket, or, you know, they come into the hospital and have a syringe or, you know, some kind of drug paraphernalia, yes, we can charge them, as long as it's not in the Good Samaritan exceptions, because we do have the Good Sam law. If you call in an overdose, you stay on the line with 911, you give your real name, and you wait and render aid. Under the Good Sam law, we cannot charge the caller, and we cannot charge the person who overdosed. That is an area that, you know, saving a life has to be more important than making an arrest. So that is our legislation, and we follow it. But if that doesn't apply and they're here in your department, or they have, you know, heroin on them or drugs, you can call your security, who will call outside police force to come in and make that arrest. But when we're tracking the people who have survived, it's almost insurmountable. So what we're doing is, we have an alert system that we set up through Cambria County 911. We are alerted on our phones. I'm part of the alert system. And our Cambria County Drug Task Force follows up with the police departments who are out at the scene of every overdose. We're compiling the reports, and we're giving them through the Drug Coalition to our data arm of us is University of Pittsburgh at the Pitt campus. So, you know, even though there's so many, we are trying to gain valuable information from it. Another thing I can talk about here is our Push Out the Pusher campaign, which has been hugely successful. And on another slide, the number is there. I also have the drug hotline posters that I've brought. If any of you want to take them, put them in your departments, put them anywhere you'd like. Our hotline is working. It's had tremendous benefits to us. We check those calls daily, just so you know how it works. It goes to an answering machine, because the people who want to be anonymous, if you have a person answer, they will hang up. So it goes to an answering machine, and they're checked. We compile the information into a police report, and we pump that information out to the police department whose area that the activity is happening in. And for those of you who aren't aware, we have over 40 police agencies in Cambria County, from the state police to the Johnstown City Police are our biggest. We have multiple departments. Some are staffed part-time and in rural areas. So we push that information out to everyone. This shows our increase in fentanyl. Is the leading cause of our overdose deaths in 2016 was fentanyl. Heroin close behind. Most of our drug deaths, too, are multi-drug toxicity. You hear about the charged drug delivery resulting in death. A lot of people are like, why can't you charge that? Why can't you find the person who delivered the drugs and charge them? Well, it's not as easy as it looks, and we finally filed last week our first strong case that we have for that. Number one hurdle we have is people don't want to tell you what happened. People don't just walk into a police department and say, hey, I gave drugs to this guy and he took them and he died. So we have to be able to link the exact substance the person took to the exact person who gave it to him. Then the second hurdle is our cause and manner of death. And if we have multi-drug toxicity, which is almost always, you can't always link what is the deadly substance that caused the death. So in other words, if you die and it's fentanyl, but you have a 0.30 alcohol in your system, did the fentanyl cause the death, or was it a combination? And the law isn't helpful in that area. But we really are trying to go at this and determine, who is delivering these substances and get them. And if we can't charge that charge, we can always charge the delivery itself. So we're trying to do that. This is Calls identified as overdoses by zip code. So you can see in the county here, and I think the darker the shade of blue is the higher the number. So you can see right in here, 79 overdoses right here in the 15901 area stretching out. So you can see a big chunk here, and then the middle of the county as well, where overdoses are occurring. And up north, that's the number 5 in those zip codes. So you can definitely see a pattern here. This is the number of naloxone saves. So first responders, police are carrying Narcan. This is where the saves are, and it really does correspond with that same area. So you can see in that same area there were 27 saves in this flooded area where the most overdoses are happening. And again, that pattern through the middle of the county where the saves are occurring. It also coincides with this is the number of prescriptions or pills being prescribed by zip code. So these are the kind of things that we look at as a coalition, through the drug coalition, to get everybody together and say, well, why is this? Why are there more prescriptions being prescribed in one area and not the other? And many good things are happening across the state to address this. Our prescription drug database went into effect a year ago. Now doctors prescribing meds check the database. You can catch the people who are doctor shopping and getting multiple pills. The other thing is the prescription prescribing guidelines are changing. So it's my understanding now if you come into the ER, you can only get a week's worth of pain meds and then you have to follow up with a doctor. These are all great things that are happening, but they're going to further decrease the supply when the demand is at an all-time high. So doing that is all great, but there is a very good possibility then we're pushing more people onto heroin, whereas law enforcement's going to have to address that. Over time, all of those are going to have a great impact. These are our relapse rates, which are not favorable. People addicted to opiates relapse 91% of the time. So not only do we have to try to get them to treatment, get them into that point of sobriety in their life, we have to plan for their relapses and how are we going to re-engage them when these relapses has happened, because they're bound to happen. And it's not just opiates, even alcohol is 75% relapse rate. Sometimes I think we're focusing so much on our drug problem, we forget about our alcohol problem in this county as well. 25% of our caseload out of the DA's office are DUIs, driving impaired. And our drug-impaired DUIs are at about 33% now. That was unheard of. Before, we rarely saw people operating their vehicles under drug impairment. It was almost always alcohol. Now it's really coming up, our drug-impaired driving, which is very scary. I had an incident that happened. I was driving home from work, and I'm on the bridge on Riverside, passing, over into like Ferndale, and a car in front of me at the light is just stopped, not moving, and he was like the third or fourth one back from the light. And I'm looking out my rear view, and I can see something's wrong with the driver, and I was afraid to get out of my car. I was afraid to do anything because I'm thinking, okay, I'm going to go up and knock on the window. Well, what if it's someone I prosecuted? What if they recognize me? What if, they're coming out of a drug stupor or they're drunk and they get violent? So I went to the car behind me, and an individual was in the car, a gentleman, and thank God he was an EMT, and he had a bag, and he said, I'll help you, and he ran. And when he got the door open and he woke this man up, real young kid, he let his foot off the gas, and the car started to drift forward, and the man with me had to hit the brake. And it was just a very scary situation. Ambulance came, and this kid got a DUI. And side note, I had to get referred to the Attorney General's office because, I became a witness in the case. I said, talk about that guy's unluckiest day to have the DA behind him when he decides to pass out in a car. But it's happening everywhere. Up in Ebensburg, we had an individual run from the Comfort Inn into the from the McDonald's drive-through, just drifted straight off into the Comfort Inn hotel because he had overdosed and passed out. So we're seeing it a lot in vehicles. Our strategic planning process, I won't spend too much time on. Many in healthcare were at the table. We had our meetings right here at the hospital, and we did develop a plan. Our mission is we're committed to positive change and the creation of a drug-free community across Cambria County. And our vision is Cambria County to be a safe, friendly, and great place to live, work, and play. Kind of broad, but these are our broad goals: to decrease the supply of illegal drugs. This is where law enforcement comes in. We've partnered with every agency, federal, state, local. We are on it. We've also pushed to get Narcan in the hands of the police to help. Second broad goal is improve system of care for individuals with substance abuse disorders. Again, this is more healthcare related subcommittee working on these things. And also this is where what we term the warm handoff is we are trying to develop a better process that when these people do overdose and their near-death experience, that they can be engaged and encouraged to go to treatment at that time. And broad goal 3 is enhanced drug prevention and education initiatives. We have a tremendous school system around here. All 14 of our school districts in Cambria County are providing the Bot-Thin Life Skills program. In addition, our universities are always at the table with us planning for safety for their students when it comes to drugs. We had a very unfortunate situation at UPJ. A young wrestler overdosed and died in an off-campus apartment. So literally it's happening everywhere. And the fourth is probably our most difficult, is to secure funding so that we can remain in operation. We have applied for the Drug-Free Communities federal grant. We've met with Representative Rothfuss, everyone we can at the federal level to try to come up with funding, which would provide us with $150,000 a year for a 10-year period if we get that grant. These are some of the other initiatives that my office has done to try to contribute to a healthier community. You might be aware of some of them. We did open a child advocacy center here in Cambria County in November of 2015. It is running really well. Post-Sandusky, whenever that case ended, there was a push at the state level to open child advocacy centers. For those of you who aren't familiar with it, here's why it's important. Back when I was prosecuting child abusers years and years ago, the process was this. If a child was abused, they would disclose to somebody, let's say a parent or a teacher. Then they would be taken, to for a medical exam, and they'd talk to somebody like a nurse or maybe a doctor. They'd tell their story again. Then they'd be taken to the police and they'd have to tell their story again. And it's very difficult, especially sexual abuse, for these kids to even talk about it to begin with. Then they might have to talk to a caseworker and then a counselor. And at the end of the day, they've told about 8 different people what happened to them. And naturally, some children will like me and not like you, tell me more, clam up when they're with you. And their detail might get more and more and more and more. Well, attorneys in court, defense attorneys, could attack that child's statement as not credible because it changed. So the push for Child Advocacy Center, we now have a forensic interview where all those people I talked about on that team that responds to child abuse now goes to one interview, and we have a trained forensic interviewer who does the interview with the child in a setting that's very comfortable for the child. It's not like in a police department where they're afraid anymore. And all of these people watch it live streamed on a TV. And then when the interviewer's done, she can come out and ask these providers, hey, is there anything I missed? So the police officer might say, hey, what color was the bedspread? Make sure you ask that. So it's still, everybody gets all of their questions in, but it's much easier on the children who are going through this. And the center then provides wraparound services. It's located at Pediatric Care Specialists who does all the exams on the children then. Also, we have our Cambria County Elder Abuse Task Force. I talked about how our seniors are vulnerable in the drug trade. They're also vulnerable in so many other ways because they like to get on the phone and talk to people because they're lonely, and they fall for a lot of scams. So we developed an Elder Abuse Task Force. Many sit on there. We tried, I was a founder of this task force, and we tried to think, where do our seniors go every day? Who would be important to be on the task force? And we figured the pharmacy, because they're usually getting prescription filled, so we have a pharmacist. Church, we have faith-based leaders on our team. I'm trying to think of the other place we thought they went. Doctors. They go for their appointments. So we have a lot of good people on the Elder Abuse Task Force. We do try to do one day a year where we do a training at our senior centers to help keep them safe. We also have the Cambria County Sexual Assault Response Team, which is really operated out of Conemaugh. This has been an incredible, amazing stride we've made in connecting our legal world with your hospital world. Now when a rape victim comes into the hospital for treatment, there are SANE nurses who respond, there are victim advocates who respond, and there's a lot of support for the victim. We also created the first nationwide anonymous sexual assault reporting protocol, and we are now being modeled across the country. We get called a lot, for our protocol. This allows a person to come in and report anonymously that they have been sexually assaulted, but yet the evidence can still be obtained and secured in the event this person changes their mind later and wants to prosecute or go forward. The reason this is important is a lot of domestic abusers will bring the victims into the hospital setting with them. They're afraid, they're fragile, they're controlled, their every movement is controlled. I've dealt with a lot of people who are victims of domestic violence. They are broken down to nothing, and then, we expect them in the court system when a incident happens and they're beat, we expect them to be so strong they can turn around and get on the witness stand and say, yep, this is what happened and he did it. They can't do it. They need time, they need an escape, they need counselors, and they need to be brought to the point where they are safe to leave. A lot of times they have children, they can't leave. I'll never forget, one day I stopped in the Women's Help Center to drop off a basket that I was donating, and I walked in the main office and there's just stuff everywhere, like strewn, shoes and clothes, and I said to the woman working there, I'm like, what is that? And she said, oh, a woman came in last night and she threw a bed sheet down. She had to get out, and she had to get out fast, so she threw her bed sheet down and she threw as much stuff as she could for her kids on the bed sheet and rolled it up like Santa Claus and got out of Dodge. And that to me was just an image of what these victims go through. And if you think the court system is their number one priority, like I want to get this guy, it's not. So we try to do what we can, but the sexual assault response team has been great because a lot of times if the woman doesn't want to report right away, she can come back later. We maintain that evidence for 2 years, and then we can test it at any time. So the Cambria County Special Emergency Response Team is our CERT team. You've probably seen them out and about. I'm pretty sure they trained here. I don't know if they've trained in the hospital. We're lucky to have this team. If we didn't have them, we'd have to wait for the state police CERT team, which takes longer for them to compile because they're coming from outside counties here. So I chair the CERT team as well. Our Veterans Court and Mental Health Treatment Courts started within the last few years. They've been working great, and it's a way for us to give back to veterans who, are having addiction problems, who get themselves in trouble. It's an intensive program, and if you ever get the opportunity to come to one of these graduations, it's really heartfelt. And for those of us who work in prosecution, we don't see many success stories. You probably feel the same way in the hospital sometimes. But this is where our success comes, when you actually see somebody take responsibility for their actions, follow a program, get help, and better their lives. It's an amazing thing to see. And then I've talked about human trafficking. We did create a human trafficking task force. Human trafficking did not become a crime in Pennsylvania until 2 years ago. So we are trying to figure out how we can investigate, make arrests, and again assist our victims in this way. The human trafficking victims are really difficult to handle in the court system, one, because they're addicted. It's hard to get them to come around and cooperate. Housing is always an issue. A lot of times they have nowhere to go. What we're finding is the women who are being trafficked are usually, everything's provided for them, from housing to their drugs to their food. It's almost a form of domestic violence because their pimps control their every movement. They're definitely beaten and battered, and it's really hard. It's hard to get them out of that environment that they're in. And when I first started talking about human trafficking, I always thought it was like an international problem. I was like, oh, we don't have a human trafficking problem here, because I'm thinking people who order brides online, or servitude where you come over and you put people to work. It's also labor trafficking. But what we've learned is it's directly tied to our drug problem. It is happening here. If you get on these websites like Backpage, Craigslist, and put in a search for an escort, it will blow your socks off. So we are trying to attack it here. Push Out the Pusher campaign I talked about. And the last thing is our Commission on Hope. We did form, this was a group that formed after one of our major shooting incidents in the city. There was a woman who was wonderful, and she was downtown, lives in Moxham, and one of the neighbors said, you know what, we ought to just dig a hole and throw them all in there and bury them. And it just upset her so much that she got a group of us together, and we formed the Commission on Hope to try to do better. One of the things that we've been able to accomplish through the Commission on Hope is programming in our prison, especially for our women population. There isn't a lot of programming because the women are housed in the unit that they're in. They can't move about the prison too often, but we implemented a trauma-oriented yoga program to help them get the coping skills they need for when they're out. We also tried to put in community coaches who are up there seeing them. They're now working toward, if they have children, visits with their children. They have a beautiful child visit room in the prison that wasn't being used very often. Now it's thriving. So, if there's one way that I think you can get to a woman who's down on her luck and in jail and drug addicted, is her children. I mean, that's innate in us as mothers, that you would want to get better for your children. So the Commission on Hope, anyone's welcome to join. Paula Epley-Newman from Beginnings runs our group, and the woman in Moxham I talked about was Rachel Allen, who really got things spearheaded there. So we're doing a lot of good work. They also started a farm out in somewhere near Jerome, I believe, where they're taking some of the inmates that are almost pre-paroled into the community. They're taking them out there to work and be engaged on the farm. So good things are happening. I know we pick up the paper and you think things are terrible around here because our crime is up, but I believe we have the ability to change what's going on here, because so many people are taking an active role now, and we are all working together. One other thing, we have our med collection boxes. You can take your unused medication to Richland Police, the courthouse, and now Carrolltown Police and Johnstown Police were just approved sites. I think with everybody doing the parts that they're doing, and the coalition being able to link all of these services together, and now our legislators responding with changing the law, it might be, a couple years down the road, but we will get out of this epidemic, and we will grow together. It's just unfortunate that the people who are addicted, we're probably going to lose more of them. And any way that you can use your skills, and you've dedicated yourselves to the careers that you're in, which is amazing to me. I mean, all of you working in the hospital are helping people. It's born and bred in you that you are public servants. You might be that one person who can make the difference. And instead of being jaded by it and, I'm sick of it, these women are having babies that, they're addicted and these parents don't care, you might be that one caring voice who at a bedside says, is this really the life you want? And you might be the one that can crack that egg who says, no, I really want help, and I don't know how to go about getting it. So if we stigmatize them, if we're short-tempered with them, they're going to feel even less worthy, and less likely to ask for treatment. So thank you for your service. Thank you for all you do every day, and keep going. And together, I really do believe we can dig ourselves out of this problem.